So after the first days have passed, soft tissues need love. L is load, and this is if you see the taping technique here, this is something that we do to minimize swelling a little bit. What we were looking at earlier with compression as part of peace. But as far as loading is concerned, even light loading is important. And if I think about this example of the ankle sprain, the idea of even the foot feeling the ground and the sensation of pressure rolling through the foot is also part of healing. If our foot's been stuck in a boot or it's been immobilized in a certain way, it kind of, I don't want to say it forgets how to move, but of course we need to slowly acclimate it back to all of those nuances of movement once again. And sensation is a very huge part of being able to navigate healing, right? You can have all the pointing and flexing and winging and sickling that you get, but when you add weight on top of your foot, when you have to impact the ground, that becomes a little different as a sensational experience. And so then how can we start to add those things back into? Optimism is always important because optimistic perceptions are always associated with improved outcomes, right? If you're, and you can call this a placebo effect perhaps, but if you're feeling good, you're gonna bounce back better. And that's why it's important for things like, for example, with ACLs. If we're doing a recovery process with an ACL, there are mental health protocols and things to fill out, so we can kind of gauge where the athlete's mentality is at in reference to their healing, right? So how can we keep a forward-thinking and progressive thinking outcome or overview of their outcomes? So psychological and emotional factors can often contribute to delayed healing, and once again, this loss of athletic identity is huge. So someone who has always put their stock in their ability to perform and dance and train all of a sudden doesn't have that as part of their identity anymore. So what does that do to our dancers and to us if it's us we're talking about, right? V is for vascularization, and that is, once again, movement is going to promote blood flow, which is going to promote delivery of healing factors and energy and oxygen to the areas that need healing. If we ice, if we immobilize, then we limit the body's ability to do that. If we take anti-inflammatories, then we inhibit that inflammatory process. Early movement, any sort of movement is always going to be good. Once again, not just about the act of physically moving, but the sensation of moving, letting pain be our guide, AKA activity traffic light. Yes. And then last but not least, exercise always. What are the ways that we can help to manage our soft tissue injuries? Not just in terms of, managing the injury is kind of like short term a little bit, right? Because you're just trying to get back to building back up to say, okay, where's my baseline? And then from there, being able to extend into proper strength and conditioning. And all of that is going to be dependent on how early you start to set the body up for that. Once in reference to something like detraining, right? Once we stop moving, there is generally going to be a decline, but then how do we keep things up? And not just in terms of strength, but we mentioned here like mobility, proprioception, right? Balance. If you can already stand on a foot, but you can't go into releve, great. There's a ton of balance exercises we can do on a flat foot to make sure that you are maintaining those sensations in your foot. So then when you get back to things like landing, skipping, jumping, your foot still has that awareness of space, right? And you've maintained those things over time. So peace and love. Any questions about peace and love? Yes.
So I don't think I had specifically heard that before. It sounds like the peace part, it primarily shortly after the injury, and love is the ongoing recovery.
Yes, you can. The recommendation in the article was saying after the first couple days, right? So if you are, let's go back to the example of like an ankle sprain. Let's use a different example. They maybe had a little knee twist and we don't know what it is. So protect, right? So let's say bending their knee is aggravating, then you're going to probably say, all right, maybe we know that movement doesn't make it feel better, right? Sometimes movement will make it feel better, but in this case, movement is not making it feel better. So this is not the time to say, well, you know what, movement is medicine, so keep going, right? So then we have to protect, we have to limit the movements and kind of really see where they are at currently. elevate, and if there's any swelling, then of course the elevation is helpful. Avoid inflammatories, and once again, this is probably something that's going to, you want to get that recommendation from a medical provider, from a medical doctor. Compression can help if there's if there's a lot of swelling. If there's too much swelling, then you can maybe like wrap to kind of keep it from blowing up. And then education, emphasizing an active approach. So from the get-go, I might even say things like, if you can bend your knee within a pain-free range of motion, that is generally going to be still safe, right? And maybe you're just sitting on a table and you're just bending your knee back and forth, just to keep the muscles and the ligaments and the fascia moving, right? So initially. And then after a couple days, after things have calmed down a little bit, perhaps, right, hopefully, then we begin to load. Then you can say, okay, I couldn't bend this much a couple days ago, but now I can bend a little bit more without pain, right? Or following the activity traffic light. Good, I can kind of proceed a little bit more. I feel better about the fact that I can put weight into my knee. I can bend it more. And then obviously with movement comes that vascularization of promoting blood flow, maybe sometimes even using heat as part of the process. Like if it's a little more sensitive at the site, let's say at the knee, then maybe I can put it above at my thigh, because I can warm those tissues up above it. And so then they're still promoting blood flow from above. And then exercise. At some point, you're getting back to all your physical therapy exercises, strength and conditioning within the ranges of motion that you need. Yeah. Does that help a little bit more?
It does, thank you. And that's I thought you had to think about the peace and love throughout the whole injury, and that's a lot of things to keep track of. But
it is, yeah. And once again, it's not like a full-on checklist, but I think it's just things to think about, right? So if I guess the example would be like, okay, are we loading? Then yes, we're loading, but that loading could be, today in rehab, we're loading it with simple body weight squats. Next week, or 3 months from now, we're loading it with dumbbells and kettlebells and weight and things like that, right? And then optimism too. Maybe like early on, they're kind of bummed about, oh man, I can't really do these things. But you're saying, well, it's okay. Like your 100% is going to look different every day. What does your 100% look like today? And if you're giving that, then awesome. And that can change too, because they might be very optimistic early on. And then towards the end, maybe there's something that just needs to be specifically addressed and they're not getting back to where they need to be. Then, obviously in my book and as an educator, but also working with educators, it's looking at, okay, where can we help facilitate that optimism for them? And how can we get that, I might even say like consistent messaging across, because sometimes we might be saying something and the teacher might be saying something else, and all of a sudden there's like cognitive dissonance and they're like, well, they said I could do this, but they said I can't do this, or oh, I feel like I'm doing really good in rehab, but in dance I'm not where I want to be. And so then how do we, as healthcare practitioner and educator, make sure that we can be on the same page so they have consistency about their healing process and that they don't get confused about where they need to be with like different expectations and such. Yeah, cool.